We set ourselves the challenge to cure colon cancer, a single message close to our hearts and now embedded in the name of our charity. What we really want is to stop people and their families suffering from the physical and psychological impacts of bowel cancer. Why? Because bowel cancer affects men and women and is the commonest cause of cancer death in non-smokers. And, unlike most cancers, it's preventable for most people.
Hi, I'm Siwan Thomas Gibson, a Professor of Gastroenterology and Colonoscopy, which is the technique we use to find and detect polyps before they turn into bowel cancer. So what do we know about bowel cancer? Well, in the UK, in both men and women, bowel cancer is the most common cancer that you will die from, with 1 in 15 or 20 of us developing bowel cancer in our lifetime. So that's 40,000 people in the UK who will develop bowel cancer. But there is some good news. If detected early, then we can cure bowel cancer in around 90% of cases. And also we can detect it before it becomes cancerous. So at colonoscopy, if we find benign polyps or growths, we can remove them, preventing cancer from even developing. So how do we do this? Well, even before symptoms develop, in people over the age of 45, perhaps 1 in 10 will have a polyp that could grow into a cancer. And so if removed, we reduce the chance of them developing cancer in their lifetime. So to stop people dying from bowel cancer, we need to get really good at finding these polyps at a really early stage.
What is Fortitude's approach to this challenge? We focus our precious funds raised by the Fortitude family of supporters on projects with a good chance of having the greatest impact. We're going to get good at finding these polyps as early as possible. There are 3 pillars of our strategy. 1. We fund UK-based research to improve early diagnosis for all people, men and women, young and old, and beyond national borders. 2. We fund research which targets specific groups with a particularly high propensity for developing bowel cancer, such as genetically inherited conditions like Lynch syndrome or FAP. 3. We develop new and innovative ways to treat early diagnosed cancer more effectively. So, are we making a difference?
Hi, I'm Dave Burling and I'm a consultant radiologist at St Mark's Hospital who specialises in bowel cancer. I'd like to give you an example of how Fortitude's research has had a major impact on early diagnosis and prevention of bowel cancer, which is the first element of Fortitude's strategy. So CT colonography, or virtual colonoscopy, is a fabulous test for examining the colon, for both cancer and its precursor, the colonic polyp. It also has certain advantages over colonoscopy. For example, it's cheaper, it's easier to tolerate by patients, more convenient. It will also show the organs outside the colon to provide reassurance and spot disease early elsewhere. I think one of the really important points in the NHS is it offloads endoscopy waiting lists. The big problem with CT colonography is the wide variability in quality amongst radiographers and radiologists practicing this technique across the UK. And the reason for that is there is no formal accreditation programme in place, and therefore there's been piecemeal training across the UK. Fortitude understood this problem and helped us to develop a national training programme for CT colonography, which has for the first time really tackled the under-provision of training and improved quality standards across the UK. So thanks to Fortitude, CT colonography training is now being rolled out across the UK, and we're training radiographers and radiologists on how to do CT colonography properly and to the highest standards.
Hello, my name is Dr. Kevin Monaghan. I'm a gastroenterologist at St Mark's, the National Bowel Hospital, and I'm an expert in hereditary gastrointestinal cancer, including bowel cancer. And as part of my job, I look after people who've had a diagnosis of bowel cancer and also people who have a history in their family of having a parent or a brother or sister or a child who's been diagnosed with bowel and other cancers. One of the areas that Fortitude are specifically funding is in people who have been diagnosed with a genetic condition called Lynch syndrome. Now, Lynch syndrome is a high cancer risk genetic condition that runs through families, knowing about Lynch syndrome can make a huge difference to how we can avoid a cancer diagnosis in people who have this condition. It affects about 1 in 400 people, 200,000 people in England. Unfortunately, only about 5% of people with this condition are known of, and as a consequence we miss opportunities for screening that we can otherwise employ to prevent a cancer diagnosis in people with Lynch syndrome. Now, the main cancer risks are bowel cancer and gynecological cancer. If we know you have Lynch syndrome, your risk of dying from bowel cancer is reduced by 85%. Now, Fortitude are supporting 3 interconnected projects in this area. They're all focused around cancer prevention, and it's called the LINK project. I am confident that we can meet Fortitude's goal of rapidly improving the detection and management of people with Lynch syndrome within 1 generation.
My name is Nicola Hodges and I'm a colorectal research fellow at St Mark's Hospital and Imperial College. The DRIVEN project, which is funded by Fortitude, aims to improve the outcomes of patients with right-sided colon cancer. At present, we don't have any way of reliably risk stratifying patients with right-sided colon cancer prior to their operation. This means that we cannot tailor the surgical approach to the individual patient based on their risk, and alternatively we are unable to reliably select patients who may benefit from an alternative treatment pathway. We aim to develop a risk stratification method which would allow us to do this. Without Fortitude's input, we wouldn't have been able to achieve the improvement in survival for patients with right-sided colon cancer.
I am Warren Hire, the consultant paediatric gastroenterologist at St Mark's Hospital, and my principal role is to identify and care for families at increased risk or sometimes an inevitable risk of colon cancer. So I've been involved with the charity Fortitude since its inception. You've now heard of the 3 current cutting-edge projects that Fortitude is funding. Fortitude is our largest single funder and supporter of St Mark's Hospital, specifically looking and researching colon cancer. And it is with this in mind that on behalf of patients, future patients, clinicians and researchers, that we offer you all a huge thank you. Because it is a combination of your enthusiasm, your commitment, your charitable endeavours as our principal partnership charity, plus the forward-thinking and questioning mind of the UK's leading clinicians at the National Bowel Hospital at St Mark's, that together, with Fortitude, we will cure colon cancer. Thank you.